This is Claudio de Giglio, CEO at Osseotouch. So here's the magnetic mallet, and that's our technology, patented, patent of invention both in Europe and in the United States, works. We have two magnets in here, and they generate an acceleration of about 5,000 Gs, which is a lot. Formula One car is about 8 G. Why do we need to create this acceleration? Because by doing that, we increase dramatically the force delivered to the mass that we want to shape, in this case the bone, up to 7 times what we are able to do when using a manual mallet. In the meantime, the time of the impact is extremely reduced, about 5 millionths of a second, which is why the patients don't perceive it as the doctor is operating. So what is the benefit of having so much force in a delicate way? The benefit is that we can now shape the bone. Instead of drilling or cutting, we can change the shape of the bone the way we need. For example, on this pig rib, I will perform a ridge splitting. So I took what we call the splitters, which is little bit thicker than a surgical blade, but strong enough to bear with impact. I'm setting the force from 1 to 4, and once I have engaged the bone, I start to tap in. As you can see, in just 3 pulses, I was able to penetrate the bone up to 12 millimeters.
You're blocking it with your hand.
Yeah.
Yeah.
So what's the difference by using an ultrasound or a drill? I am moving this bone. We're not consuming, we're not removing any bone, and most of all, the impact happens so fast that we do not generate any heat on the bone. That's why we don't need to use any irrigation water, which is going to increase the field of visibility for the operator. And in the meantime, we're not going to wash away all the important regenerative factors that we need for the osseointegration of the implant. After I did the first invitation, I just need to change the instrument. In this case, it's an expander, and I start to expand the crest. I can also lower the force, and here's how I do my expansion. After I have expanded, I can start to create the implant site. So here we have an Osseotouch, pretty sharp, which has the same function of the pilot drill. There you go. In just a few pulses, I was able to create my implant site, and in the meantime condense the bone, which is what is going to give the primary stability. Through the laser mark, I'm always in control of the depth of the implant site I'm creating, and every time, every pulse corresponds to about 1.1 millimeters. So this is the way that we can now shape the bone, avoiding to use drills or other or other more invasive technologies, and the result, for sure, it is a faster procedure, a controlled procedure, and a minimal invasive way to treat the patients.
Thank you.